Transition. In your Blackboard learning system, you're going to be provided with printable lecture notes. It's recommended that you print these notes off so you can take notes as you listen to these lectures. You will not remember everything you will be told during this course. You need something that you can refer back to. We also suggest that you create a notebook with PowerPoint slides and notes for each class that you take in the program. Creating tabs within that notebook will help you easily find various PowerPoints. But it's also going to be helpful during the year to be able to go back and review material that's covered during this course and subsequent classes. First of all, we're going to introduce you to your instructors. On the Pratt campus, Deb Taylor and Johanna Bartels. On the Wichita campus, Shirley Breath, Tasha Cooper, Shelley Detweiler, Linda Gimler, Marcia Nicholson, Kay Leidick, and Colson. The administration at Wichita Area Technical College consists of the Vice President of Academic Affairs, which is Sherry Utash, the Dean of Nursing, Dr. Gail Withers, and the Director of Nursing, Patricia Plank. Nurses are often described as an art and a science. Nursing is a profession that embraces dedicated people with varied interests, strengths, and passions because of the many opportunities that the profession offers. As nurses, we work in emergency rooms, schools, school-based clinics, and homeless shelters, to name a few. We have many roles, from staff nurse to educator to nurse practitioner and nurse researcher, and serve all of them with a passion for the profession and with a strong commitment to patient safety. Transitions are passages or changes from one situation, condition, or state to another that occur over time. The transition may be positive, it may be negative, or it might be neutral. Transition may be desired, or it may be undesired. Transition is a part of life, and it's definitely a part of nursing. But often, if we know what to expect, the stress that is associated with the change or transition can be reduced. There's different types of transitions. We have developmental transition, which would be like becoming a parent or a midlife crisis. Situational, which is nursing school, graduation, divorce, having a child, etc. Health or illness is dealing with a chronic illness, surgery, trauma, an extended acute illness, health of a significant other, parent, or child. Organizational is a change in an instructor, staffing changes at work, etc. Nursing school is going to become your life for the next several months. You're going to need to educate your family on the time constraints that's required for nursing students. Nursing school is not like routine college courses. It is more consuming and more difficult. This isn't said to frighten you, but only to make certain that you know what you're getting into, that you're going into this with your eyes wide open. Nursing is one of the most fulfilling and rewarding careers that you will ever be involved in, but it comes with a price. Again, nursing school will be your entire life for the next several months. You have to make this commitment, and your family has to make this commitment for you to succeed in this course. We look at professionalism and ethics. This is a big part of nursing. Ethics is an integral part of the foundation of nursing. Nursing students are expected to act ethically at all times. This entails being honest with your work, with your tests, and following the policies of your school. This also relates to your personal life. It's important to act with integrity and pay attention to what you say and do. Now, your instructors and the nursing program take this very seriously. Professionalism means that you act decorously with good manners and you treat others courteously. Professional behavior is a part of nursing school, and you will be observed for appropriate and professional behavior throughout your nursing student career, the clinicals and lecture. You must dress appropriately for clinicals. You must be prepared for class and clinicals. You must have the appropriate equipment, and you must complete the required paperwork. Arriving early to class or clinicals is professional. Advising your instructor if you are going to be unavoidably late or are ill prior to the start of class. Completion of assignments and turning assignments in on time is the mark of a professional. Understanding and remaining flexible concerning potential calendar changes. This is the dirty word of nursing, flexibility. If you have concerns, you must follow the chain of command, beginning with the instructor of a course. Taking concerns to another instructor or out of order of the chain of command is only going to delay problem resolution. So if you have a concern, the first person you will go to will be the instructor of the course. If you do not receive satisfactory resolution, you would move on to the director of nursing. Again, if you do not receive satisfactory resolution, you would move on to the dean of the program. If you don't receive satisfactory resolution there, you have the opportunity to move on to the academic vice president, and that would be Sherry Utash. We usually do not take anything to Dr. Kinkle. You are going to be held to high standards as a professional nurse, and we start the training for this professionalism with nursing school. Then we look at HIPAA. HIPAA is something that you are going to be expected to adhere to throughout your entire student nursing career and beyond. Violations of HIPAA may result in civil and or criminal consequences. HIPAA is what protects a client's privacy. Remember that your instructors are all rooting for you. Your instructors are available to help you. But on that note, your instructors are not here to socialize with you. We have to maintain the instructor-student relationship, but that does not mean that we don't care if you pass or fail this program. We care very much. Also realize that your instructors or the nursing staff you work with may not always instill those warm, fuzzy feelings in you. Don't take it personally, because we do have other focuses. Maybe a client's status is changing. We might have a headache. We may have personal concerns, etc. So we may not always seem real friendly. On the flip side, if you have personal issues, concerns, etc. going on in your life, your instructors really need to know the basics of what's going on. We don't have to know all of the details, but we can't help you succeed if we're not aware of issues that may be preventing you from doing your best. So please keep us updated on what's going on. Understand that the field of medicine is constantly evolving, and there is no way that your instructors will know everything, but they will guide you in finding the correct answers. If you have issues in nursing school, administration looks at how you utilized your resources. Do not wait until you're failing a course before you seek help. Your instructors are here to facilitate and guide your learning. We are not here to learn for you. You are responsible for your learning, and you will need to adapt to each instructor and/or course. You are going to be held accountable. You are responsible for your own actions. Your instructors are also going to be providing feedback. Feedback is provided for personal growth, and it's not used to belittle you or to make you feel bad. Your instructors will look for ways for you to improve, and sometimes we might have to look pretty hard. But if we do not point out areas where you can improve, you're never going to grow in your skills or your knowledge. We do also make an effort to let you know when you do something correctly, because you also need positive feedback. Remember that you are all adults. Your instructor's goal is to provide each of you with the skills, the tools, and the knowledge base necessary to pass NCLEX, or your licensure examination, which is a test of minimal nursing competency. Your instructors are not here to design the courses to meet your specifications. Understand that your nurses have been through nursing school and they have taken and passed the NCLEX examination, and they know what you need to be able to pass that test. Successful completion of this academic year will qualify you to sit for the NCLEX examination. So once again, we talk about professionalism. You as a student must maintain a professional appearance. This includes how you look, speak, and act or react. This is expected of you every day and also applies to clinical. Your appearance, you have to be clean. You have to be odor-free. And I'm not picking on those people who smoke, but when you smoke, you don't understand how the smoking odors permeate your clothing, your backpacks, your books, and everything around you. So, especially when you are going to a clinical situation, number one, you are not allowed to smoke at clinicals, but number two, please do not smoke in your uniform prior to coming to clinicals, because the odor will be in your clinical uniform and you will be sent home. Your attire must be clean and it must be appropriate for the task or the role that you are required to do. Your behavior, again, you must be prepared and have all of your materials that you need for that particular class. A neat environment. You will need to pick up after yourself. Your instructors are not your mothers, and we are not required to pick up after you. Attendance and punctuality. Be in your seats and ready to go at the start of class. You will be given breaks every hour. If you are going to be absent or tardy, you must call prior to the start of class. Classroom illness. If you are contagious, we don't want you in our classroom. Use antibacterial wipes or antiviral gels to help decrease the spread of germs. And cost containment. We are a nursing school and we don't have a plethora of money. This comes from your tuition. So to keep costs down, please take care of equipment and supplies. Verbalization. Make sure that you use appropriate language. It is essential to become a professional nurse. Cussing or bad language will not be tolerated in any manner. You must use courtesy. Please and thank you to your instructors and classmates. Written work must contain correct grammar, spelling, and professional language. No slang will be accepted. Non-judgmental attitude must be used. Accept people where they are. Not everyone has the same experiences that everyone else does. That does not mean that they are less of a person or a worse student. There's many right ways to perform a task or a skill. If staff is doing something differently, ask questions or talk with the instructor privately. Again, there is more than one way to accomplish a task. Cultural sensitivity. This includes values, attitudes, and beliefs. You have to be sensitive to someone else's values, attitudes, and beliefs. And it really is important as a nurse to try to learn about the various cultures. It will help you be a more effective and competent nurse. Reporting problems. Again, privately notify the instructor of any violations, whether it's with one of your classmates or whether it is with a clinical situation and you see something another nurse is doing. Keep this conflict private. We do not condone conflict or confrontations in a public place. Honesty. This includes copying, cheating, plagiarism, etc. And believe me, we do have ways of double checking to make sure that your work is your own work and that you're not copying or sharing information with your classmates. It is essential to professionalism, and you need to be strong enough to be able to admit your mistakes. Pay attention to your verbal and nonverbal communication. You send cues with every movement and with every facial expression, etc. For example, don't sit with your arms crossed. Be open to new experiences. You're going to come across a lot of those during your nursing career. Be open-minded to listen to doctors, nurses, the instructors, or whomever is teaching you or talking to you. They have some information that can be very valuable in your career. You're here to learn, and your body language indicates how interested you are. Try to always respond in a positive manner. And remember netiquette. Respect, respect, and respect. Bashing of students, instructors, or the school is not allowed, and it goes against policy. No foul language is accepted on the internet. Keep your comments respectful. You can agree to disagree, but no rude behavior or comments will be tolerated. Don't send emails or postings in all capital letters. This indicates yelling. We can't see your expressions, and we may perceive it as being angry or disrespectful, even if you did not mean it to come across that way. You're going to learn to think like a nurse, and you're going to hear this over and over again. We look at the nursing process versus critical thinking. The nursing process is a tool, and critical thinking is how you use that tool. The nursing process will get you where you need to be with patient care, but you're going to have to use your head, your brain, to make the nursing process work appropriately. The nursing process is a systematic way of determining your client's problems, realistic goals, interventions to achieve those goals, and the evaluation of those interventions to see if those goals were achieved or if something else needed to be changed. Critical thinking is using your head. It's deliberate, purposeful, and informed. With critical thinking, it changes with circumstances. One size doesn't fit all. So we look for changes in the client or the situation that will require you to make a change in your approach. Critical thinking is a skill. You will learn to develop critical thinking skills by seeking out real and simulated experiences. Always be asking why. What? Why should I do something this way or that way? Why is this happening? What can I do to change this outcome? What can I use to accomplish this goal if I don't have everything I need? Remember, you're never going to learn everything there is to know about a nurse, but being able to think like a nurse, you can come to logical conclusions. Think on your feet. Very few patients are going to have read the textbooks and know how the course of their disease process is supposed to unfold. Things will happen and changes can occur in the blink of an eye. You have to learn to change course in midstream and take care of whatever new situations may be presenting themselves.